All right, hey everybody, it's Dr. Mark Hyman, and I'm really excited to be here with my friend and longtime colleague, the actor Dr. Deanna Minich. She's quite an amazing woman. She's a PhD in nutrition and has been a key part of the Institute for Functional Medicine for years. She's worked with Dr. Jeffrey Bland really closely. She's written tons of papers, amazing books, and is my go-to person when I want to learn about nutrition and phytochemicals in food and nutrigenomics and all the cool stuff that makes what we do so effective. And she's been doing this for a long time. She's really done amazing
Really
work.
old.
She's not. She looks like she's 20. She hasn't changed in the 20 years I've known her, that's for sure. I don't even know how she was a PhD because she's just so young. But anyway, she's really passionate about this field as I am, and is one of the leaders in the field of functional medicine. I'm just so grateful to have her on our show. And I just tell us a little bit about how you got into the whole idea of food as medicine and even more color as medicine, because that's really about what you're focused on now, which is this, in fact, your new book, The Rainbow Diet, which is all about colors.
I have become all about color because nutrition is so complex. And so it's kind of like, what's the unifying force out there? What really connects us in and what creates change in our lives? And so I've taken kind of this artistic route, which is also really connected into the science. So the way I got started in color, I was thinking about this because, I could say it's working with Dr. Bland and working on all the phytochemical research that I did some years ago. But I actually think it goes way back to when I was a child, and my mother was a health nut.
Oh, wow.
She was such a health nut that I remember her wagging her finger at me and saying, "Deanna, you have to tell the kids at school that the whiter the bread, the quicker they're dead."
Oh, that's a good one. I like that. Whiter the bread.
Well, and then it turned me on to like white bread. What's the big deal? My bread at the time, and now I don't even eat bread, but it was brown. It was like that Adele Davis grainy bread with.
So your mom was a hippie, basically.
Well, it's kind of interesting. She wasn't. She was very religious, actually. She was really into her food and really into her faith.
Ah.
And so she was really into Richard Simmons, Adele Davis. But if I think way back when, I was always wearing those. I grew up in the 70s, so I was wearing those rainbow shirts. And
Yeah.
I was really tuned into color very early on. I did my master's on carotenoids, and carotenoids are colorful plant compounds in the environment. So they're in tree leaves, they're in food, they're everywhere.
And salmon.
So
and
salmon,
wild salmon.
astaxanthin, yeah, you would get some of those carotenoids even in animal foods. That's true. That's a good point. But they eat the plants
Right.
that give them those carotenoids.
Right. And they
right?
actually inject color dye into farm-raised salmon to make it orange.
Yes, and they and into meat as well to make it more red, and into butter to make it more yellow. And it's amazing the power that color has on us as a society.
Well, that's exciting. So tell us about your book and why you're so excited about the Rainbow Diet.
There are all these different kinds of diets out there, right? Paleo. I mean, remember you talking about vegan and flexitarian, keto, and
Right.
again, I kind of feel like, how do I create something and create a message that works, a message that really helps people to be healthy and really gets them in tune with eating in a different way? And that's when I came up with the Rainbow Diet, which is about eating the colors on the plate as much as it is about having a colorful life.
Yeah.
In fact, Mark, there was just a study just today, literally just today, I had communication from a researcher over in Germany who is publishing a paper in March 2018 showing that when people track their colors, that they tend to eat more vegetables.
Yeah.
Quite honestly, I wouldn't have thought that. I would have thought...
Not Skittles.
Right. Skittles or all kinds of,
M&M's. M&M's my
and-
favorite colorful food, yeah.
But no, seriously, they did find that increased color variety and perception, and when you track it on an app, and this is something I'm creating right now, is actually an app to help people to see how the colors that they're eating is tracking to how they're feeling. So, if we're eating colorfully, my premise is that we're going to live a colorful life, because that's what I've seen in my programs over all these years. So now having this research article come out, continuing to do that work. So what the book is about is, how do you have a better understanding of color in your life through your food, through all the phytochemicals, and through your life and how you live? Having a red day is kind of like one that's about anger and stress. And so then we think about the red colored foods and what supports that in our bodies, right? A lot of these high vitamin C containing foods. Another element that I have in the book, and you know this about me just because of my work with Jeff Bland, of course, is I spent 10 years in the supplement industry. And so what I'm bringing into this is how do you actually effectively combine food and supplements? And I don't feel like people understand how to really bridge them together.
Yeah, how do they?
Well, it's about really starting first with the colors, right? Getting your foundation. And I think you talk about this as well, that, and I think there are many reasons why a lot of the supplement studies are kind of mixed.
Yeah.
And one of the reasons I think is because it's a hodgepodge. People they have a bad diet. You don't know their genetics. You don't know their environment. You don't know their toxic burden.
Yeah.
And then they start to layer in all these supplements thinking that they're going to work like a drug or that they're going to take care of everything that you've just done and undo it. And that's not the case, right? So it's first starting with food and then effectively layering in the supplements as needed.
Well, that's why they're called supplements, right? They're not replacements for a healthy diet. They're called supplements.
Right.
That's great. So how does someone know if they're deficient or if they have too much of something in one area?
So there's a quiz in the book. So they take a quiz and they can figure out, and the way that I have this structured is that there are 7 colors, 7 areas of your life, 7 classes of food. And so it all kind of syncs up. So you can do the questionnaire and maybe you're low on the red, high on the blue, purple. So it just kind of depends where you're at. So you can kind of flip around in the book. It doesn't have to be a book that you read from start to finish. It can be more or less a reference book.
So then you talk about the kinds of colorful foods that make the most difference for us, right? Because they all represent different kind of chemicals that have different effects on the body.
Right.
So that's just a beautiful thing about it. You don't have to know what's in it. You just have to pick like a rainbow when you go to the grocery store, right? It's what I do. I literally go to the grocery store and I think of it as my pharmacy, and I go around the outside of the store and I look at the vegetables and fruits and I pick the colors based on what I know is in them. But it's like that's my drugstore.
Yeah. Yeah. Excellent. And you're an exception. I think so many people aren't quite sure, right? And we actually get into food ruts. There was a study that showed that 8 out of 10 Americans do not fulfill their phytonutrient levels throughout just on day to day. And so 8 out of 10 times, just think of it, we're probably missing some color somewhere. Yeah. And I've noticed that people like to eat brown, yellow, and white foods. Yeah. Repeat, brown, yellow, white. I mean, look at breakfast. Bacon, eggs, cereal products, bagels, bread. I mean, it's all brown, yellow, and white. Yeah. There's not a lot of color.
Yeah. Well, I have a theory I want to ask you about because the whole phytochemical area is quite fascinating. And I think that these are compounds that are in plants that have biological effects that support health. And, we don't think of them as essential, right? We don't think of them as vitamin or mineral as essential. But what I sort of understood is that we've evolved with these plants to do things to our biology that actually need to happen, like control inflammation or help detoxification or help reduce free radicals in our body. And they're not essential, but they're actually maybe they're actually are essential to live a healthy, vital life. So you can get by and not be sick and die right away. But like if you don't have phytochemicals, I think your health is greatly diminished, right? And it's they are kind of essential. What do you think?
I think they're absolutely essential. I'm really glad that you raised that point. In fact, if you and I were to debate about whether or not plant foods are essential or whether or not they help with reducing the risk for chronic disease, there would be no debate. There would be no arm wrestle because the science on it is just hands down. It's just across the board. Dementia, cognition, prediabetes, diabetes, metabolic syndrome, cancer, cardiovascular disease, on and on and on, infertility. You probably can't name any type of chronic condition or state that people are in that there isn't some type of literature around fruits and vegetables. So to your point about how they've...
I'm listening.
Yeah, and how they've helped us evolve. I like how you say that because I'm reading this book called Sapiens, which is a really interesting...
I'm reading that too. I love that book.
It's really... looking back in order to help us to look forward, of course. So, that's on my mind. And so I think they help us to modulate because look at the complexity of plants. They're pleiotropic, which means that they have multiple effects. And even when I was working with these selective kinase response modulators, which are essentially plant extracts, they don't just go in and shut down pathways. They get into the cell and essentially create better communication. They help to modulate rather than to stimulate or inhibit. Right. There's something in between. So they're kind of like, well, they're adaptogenic if you think about it that way.
Yeah, that's powerful. So, I'm launching this brain health series called Broken Brain, about how our brains are affected by so many factors, including food. So people actually talk about brain foods, and I think that's an important area. What do you have in terms of your toolkit around brain foods?
So I align brain foods to the blue-purple spectrum. And if you look at the science, there's really good reason for that. I mean, there's just copious literature on berries of all different types. And in fact, probably the preponderance of literature is really around blueberries, really simple, practical blackberries, lingonberries. A lot of these berries, because they're very rich in a lot of these bitter flavonoids, they can help to modulate our mood. And when we're more relaxed, we actually think better. There is that food-mood continuum.
So if you're blue, you eat blue foods?
Yeah. And in fact, if you look at all the colors, the color that people eat the least of is blue-purple. So 88% of people do not get enough blue-purple on a daily basis. So that really tells us something. I'm glad that you're putting on this summit and that you have, because it's so essential to be looking at colors and how that's affecting our brain. In my other book, Whole Detox, I went through high flavonoid containing foods, because flavonoids act as benzodiazepine receptor agonists. In other words, it's like Valium. They essentially help. Yeah, they calm us. They're really helping with a lot of our mood effects. And so the berries help in that, as well as cocoa, cacao.
Oh,
my
perfect. You're talking my language, chocolate.
It's like, wow, all the things I love. Well, then there's also things like fish oil and omega-3s, because we have fat heads, right? It's the majority of our brain is fat, as you know, you being the kind of the fat king out there with your book. So yeah,
you're calling me fat? You're saying I'm a fat king?
No.
Okay.
In a good way. You are the lipids. You are the king of lipids.
Okay. So how about anxiety and depression? What would you, besides the blue foods, what would you do for that? The flavonoids you mentioned, which come from what foods?
Yeah. Well, sometimes it's just really basic stuff. I remember talking with my tax accountant, and he was complaining to me about how his 8-year-old son was just so cranky and irritable and just angry. And I asked him, I said, well, what is he eating? Yeah. And he's eating lots of sugar. He was eating a lot of what I would consider to be inflammatory foods. Yeah. And, that stuff impacts the brain. It impacts our mood. What is depression? It's brain on fire, right? What is anxiety? It's heart on fire. It's just a lot of these. And the brain and the heart are definitely, they need to sync up, right? Heart rate variability, parasympathetic, sympathetic tone. So what I think is good for anxiety and depression is everything that would be good for the brain. So back to the blue purple, but then also including, if you can follow something that is more like the Mediterranean diet, there are actually studies that show you have a reduced risk of depression. I mean, the science is there.
Powerful. So let's talk about not only what we're eating, but how we're eating it. How does that help us?
Sometimes I think people are in this state of what I would call analysis paralysis. So they're thinking so hard about, what do I eat? And they almost get a little bit too anxious. They create their own food and eating disorder by having such an attachment to every single meal and what they're eating. Yeah. And if you look at it, I mean,
you call that orthorexia. It's like anorexia, but it's called orthorexia, to have correct eating, which makes people crazy.
It does make people crazy. And I have been one of those crazy people, by the way. I mean, especially having a health nut mom and growing up with that spirit of watching what you're eating. And so you kind of get so fixated. And so even for myself, that's why I've taken a more artistic approach. So this idea of the how of eating, what's really neat is that we're seeing a lot as it relates to mindfulness and how we eat. I'm not a huge fan of that word mindful, because I feel like we want to be less in the mind,
Right.
but it's the idea of the pause. It's the idea of being aware. There's a study that I can think of just even now. It's one of my favorite studies, and it's not even a recent one, where they had type 2 diabetics.
Yeah.
They had them go through a 12-week mindfulness training,
Yeah.
kind of the John Kabat-Zinn approach, right? And essentially what they found was that within 8 to 12 weeks, hemoglobin A1C came down. A lot of the parameters that they were tracking had improved just by focusing on mindfulness. It's kind of like just slowing down.
Mm-hmm.
And even when I think of the Mediterranean, I mean, you travel a lot, and so you see how probably in warmer climates they eat a lot differently than they do in colder climates. Yeah. And I think about that in the Mediterranean, where there's a sense of relaxation. It seems like they're eating all the time, quite honestly.
Well, they eat for long periods of time.
In long periods, they're
like
sitting at the table
lunch.
for like 2 to 3 hours.
Right.
But it's, the manner in which they're eating. I mean, there was a study, I think it was American Journal of Clinical Nutrition, probably 1998, in which they showed that relaxation promotes better digestion of carbohydrate than over chewing.
Sure. Wow, that's impressive. Yeah.
So it's the how, being relaxed, that changes our gene expression. It changes our ability to be stressed or not, oxidatively stressed. So I think it's important for eating because we see that stress has such a huge effect on our health. I mean, pessimism, stress can lead to inflammation.
Yeah. Well, that's why I always tell people, like, take 5 breaths before they eat, like just deep breaths. And that's enough to really reshift your whole biology. It's just the diaphragm that moves in this way that actually activates the vagus nerve, which is your relaxation nerve. And it's something you have accessible to you all the time is your breath. And all you have to do is tap in for 5 breaths, and it makes a huge difference. I call it take 5, which is 5 breaths, 5 breaths to the count of 5 in, count of 5 out, 5 times, and you're like done, and it's less than a minute probably. And
I like that.
Yeah.
I talk about the 4 square breath. You like 5, I like 4.
Whatever. So, it's just because take 5, it sounds good. There's no.
I know. I like this. Very, very good, Mark. But Jack Kornberg and I used to talk in the clinic about the 4 square breath. Breathe in for 4, hold for 4, release for 4, hold for 4, and just imagine drawing that. But
that's a good technique too. Yeah.
Yeah, everybody has, all these. Mimi Guarneri has her own breathing technique out there too. I mean, everybody kind of has their favorite, right? But the key thing is just that we slow down. I mean, even you saying that just made me pay attention to my breath right in that moment.
Right.
So I think the more that we keep it top of mind, more aware, it's just like, we'll be there. We'll be into that. We'll be in that zone.
It's so true. So it's a new year. Everybody's thinking about their resolutions, goals, probably weight loss. People like go on diets and then they fall off diets. So, what do you think about making resolutions, and how do we make small changes that can lead to big wins?
I'm just going to go with an intuitive response here, and that is, I kind of feel like I've been looking at the work of B.J. Fogg. Do you know who B.J. Fogg is? He's a behavioral.
It's about behavioral science. Yeah.
Really good stuff, and he's at Stanford. And one thing that I'm learning from him that I haven't always incorporated, but I think for 2018 I'm going to bring this more into the work that I'm doing, it's the act of celebration. What he talks about is anchoring something small into what you're already doing. Many of us, when we start the new year, we think, okay, I have to go out and get a gym membership, or I have to go to this health food store way out here. But that's not really the essence of what keeps things sticky is to do things that are already within our routine and just add on a little bit.
Right.
So, and celebrate. And after you've done it, you celebrate. And I don't even think for myself, I haven't celebrated enough of my changes. But starting small is everything. I think you said it. I talk about the snail and the grasshopper. Sometimes we have a grasshopper kind of change where we just jump. We're ready for action. We leap. It just shifts. But most times change takes place like a snail. And those are the sticky changes. Just really one quick story on this. I remember telling a patient to do 4 jumping jacks a day. I was trying to think, how do I move him to incremental movement?
Yeah.
4 jumping jacks a day. He's like, okay, I think I can do that. And so he comes back in 3 weeks. And I asked him about his jumping jacks. And he's like, well, that was so ridiculous. I did 50 jumping jacks a day.
Right.
And he felt really good about it. It was kind of like, when we set the bar a little bit low, I think we're overachievers. We're
Yeah.
perfectionists. We have high expectations. Let's just, for 2018, set the bar low with the goal to sustain. And I
Right.
think that that's more important than setting the bar high and then in February we fail. So just
Yeah.
pick your one thing, make it little, make it small, make it something that you can do every day, and then,
Yeah. It's true. I mean,
track.
his whole thing is really fascinating. It's like you have to have the desire, motivation. You have to have
Yeah.
the ability,
Ability.
and you have to have the trigger that's going to make you remember it and do it, right? So,
Hmm.
like for example, getting older, I want to start doing push-ups. So I think, okay, what do I do? How do I do this? Because, so I decide, well, I take a shower every day. I can do, push-up before I get in the shower every day, and just on my bathroom floor. Like I just go down and do push-ups, and start with like 10, and 20, and then 30, then I do 50, and it's like awesome, and it's changed my health and my body, and it's effortless because the trigger is the shower, right? So I think you can do that with food too. You have to have the motivation, the ability, the desire, and then your trigger. So like if I make sure I have my cupboard stocked with the right food. When I open to get a
Right.
snack, I'm not going to go for a Twinkie. I'm going to go for nuts or something else that I have already set up. So make it easy, and you don't have to think about it. Or if I have it in the fridge, what I want, I don't have to think about it. I want to do it, so it makes it easier. And I think that's a really important strategy. Yeah.
Yeah. Yeah. No, I like it. And he talks about a very similar example, right, in his TED Talk where he also wanted to move more. And so every time he went to the bathroom, he would do a couple of push-ups.
Yeah.
So I think, yeah, we just starting small with something like that. And I like what you're referring to, even with the kitchen, if it's within our view, we're going to connect to it. If it's not, we're not. So just keep things visible.
Yeah. So in addition to food, what do you recommend that your clients and people do on a regular basis to create better balance in their life?
With all the working moms that are in my programs and do a lot of work, I just feel like the thing that's missing is stillness, is silence, is just really alone time. It's almost like the act of just not doing anything. So when we think about our to-do list, it's almost like, really, really want to see is just people having just even a couple of minutes. So I use apps for that purpose for myself. So when I go to bed, I have this app that I set. It's just a nice sound that kind of keeps me in that resonance. And so I stay there for about 10 minutes or so. But I think if people can find themselves, I mean, we're just in distraction and just there's so much going on right now. And I feel like people are so looking on the outside for answers. And so if they can just find more stillness, more pause, and more repose on the inside, stop reading books. And here I am talking about my book, but I kind of feel like, what, just table the books
It's
for a
true.
while.
It's true.
Put them aside and just really, I mean, even to do your own writing, to see
Yeah.
what comes out from within.
Yeah, it's so true. I mean, I remember an old Hindu yoga teacher said, "I'm not a Hindu, I'm an undo." And I think, I think
That's clever. I have not heard
yeah,
that.
that's a good one. And I think, for me, I've enormously busy and studied meditation when I was younger and came back to it recently and found that it's just powerful. 20 minutes twice a day. I just take a break, I sit down, and it's just totally restorative. It's powerful, it's energizing, and it's like changed my life.
And if you can't do like 20 minutes twice a day, I mean, start with 1 minute.
Yeah.
Back to DJ Fogg, start with 1 minute. Set your iPhone timer or whatever next to you and just do the minute.
And the truth is
see.
now I don't have the time not to do it because I get so much benefit from it that it's sort of like essential, like eating,
Right.
Yeah, it's
Yeah,
great.
it's so key.
Well, I'm so glad to have you and talk about your book, Red Rainbow Diet. Everybody check it out. It's coming out January 1st. And where can they learn more about you, Deanna, and your work?
So good to be here with you, Mark. Thanks so much.
Yeah. Where can everybody learn more about your work? Go to your website. What is it?
Yeah, my website, which is deannaminich.com. It's DeannaMinich.com. And everything is there. So my podcast, the books, all of it. And so, yeah, thanks. And off to a new year of great things, right?
All right. Great to have you, Deanna. Take care of yourself.
Thank you. You too.